This morning we are continuing our health series with Root Cause Medical Clinic. If you are suffering from arthritis or other types of chronic pain, then you know how debilitating it can be. Well, our next guest says he can help. Dr. Jordan Axe from Root Cause Medical Clinic is back to explain. Good morning. Good to see you again.
Absolutely.
I love that we're talking about this issue in particular too, as with the others. This is something that a lot of people are dealing with.
Yep.
Every day. Maybe they're going to see their doctor and they're just hearing, oh, it's old age, or oh, maybe we can do this. You guys are looking at this a little differently.
Yeah, most people don't really realize how many options they actually have. They go in, they say, you have options 1 or 2, when really there might be 100 different options. And two of the biggest advances that we're seeing right now, one is prolozone and one is stem cells. And like you said, people are in pain, right? You can't run, you can't exercise, you start gaining weight, and it really destroys people's lives.
It's a triple effect. I mean, the effects that come after this are huge.
It's not just knee pain, it's your mobility, it's your life, really. Yeah. But one of my favorites is actually prolozone, and it's actually oxygen, it's ozone. And the great thing about that is, most things have side effects now. Guess what the side effects of oxygen are?
What?
None. It's literally, obviously,
really?
most of us know oxygen is healthy.
Okay.
And it's actually an anti-inflammatory, a natural one. You could have prolozone injections into your joints 1,000,000 times with no negative side effects. So it actually decreases inflammation and helps regenerate that joint.
And that's that buzzword that we're hearing, regenerate. I know that's where stem cells comes in. We're hearing a lot more about this in your office as well?
Yes, absolutely. Another therapy we like to do, obviously there's PRP, we do stem cells. And stem cells are amazing because, and prolozone as well, because basically what we're doing is we're taking your body's own healing properties and concentrating them and putting them back in your body. Right? When you were 1 year old, you healed extremely quickly. Basically, we are concentrating those factors, putting them back into your body, so that joint or that wherever you're having pain at is going to heal like you were one.
The traditional treatments, again, going back to cortisone, I feel like people get a lot of those shots, and then surgery as well. Talk about why that may not want to be our first option.
Right, because as a doctor, it's first do no harm.
Okay.
Right, that's kind of our oath. So surgeries and really a lot of medical treatments, it's 225,000 people a year die from infections and drug interactions. So when you're going into surgery or something like that, it's a really dangerous thing.
It's not a decision that should be taken lightly.
Right.
Okay, let's just go to surgery.
And most people think, oh, my insurance covers it, this and that. Yeah, but you still have co-pays and deductibles, and it's really not worth the risk. And like you said, cortisone, they actually found that erodes the joints. So it's literally doing the opposite of why we want to heal the joint, not erode it. We're literally doing the opposite of why we signed up.
Which brings me to my next point as we have a minute left, because I think so many times, again, doctors, well, it's just because you're aging. Why is it that maybe sometimes you're aging in one particular spot and not the other? If we're aging, shouldn't we be aging everywhere?
And this is literally why we're in so much pain now. We're missing the boat. It's because of scar tissue. Again, you might have been 18 playing football, got injured. Scar tissue caused the joint to not move evenly, and then you got arthritis or joint pain. So if you don't address that, you're never going to fully...
Going back to that root cause.
Exactly. I love it. You got to get to the root cause by addressing the scar tissue. The biomechanics is what we specialize in. Then use regenerative medicine to actually rebuild the cartilage.
All right. Well, again, your passion is educating people, maybe kind of rethinking, retraining people how we think about pain and the options. You have a great dinner you want to invite people to do this as well.
Come to the dinner. It's one of my favorite hours with people because, again, I love to educate people. In an hour of your time, I'm telling you guys, this changes people's lives. I don't care if you have an autoimmune disease or joint pain.
Yeah, this is just one issue we faced that we talked about this morning, but a lot of other.
Absolutely.
Doctor, thank you so much for being here. We look forward to seeing you again next week.